Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Hey, good evening, and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. I'm Joe Chapana. We are live, and for the next half hour, we're going to be talking about hip and knee arthritis. Actually, arthritis and knee injuries. We'll be focusing in on the hip and the knee. And I want to remind you that Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks. We're going to give you numbers to schedule appointments for that at the end of the program. Right now, though, I'd like to give you our toll-free number to call us with questions. If you're having problems with your knee or your hip, 1-888-634-7488. We have a local number, too. It's 856-767-8884. If you prefer to email your question, you may do so. The email address is wpsjtv@aol.com. To answer your questions tonight, we're pleased to have Dr. Jess Lonner, who is an orthopedic surgeon with 3B Orthopedics. They're located in New Jersey and Pennsylvania. And also David Anselmo, a physical therapist with Cross Keys Physical Therapy. Welcome to the program, gentlemen.
Thank you. Thank you.
Great to have you here. Since we're going to be talking about the knee and the hip, Dave, why don't you show us what the hip and knee are all about there?
Start with the hip first. Start with the left hip. Okay, this is the pelvis here. This is actually the hip. This is the head of the femur. You see right here. This is the acetabulum. It's actually a true ball and socket joint. You can see it goes in there. This is the neck of the socket of the femur, the greater trochanter. Look right here, this is the lesser trochanter, and this is the shaft of the femur. As you see, it keeps continuing going down, and it goes right to the knee. Let's go to the knee now. This is the femur. Right here. Let's go around here. This is the patella. This is the tibia. This is the fibula. All right, let's go to the tendons and ligaments here. It's the superior patella tendon, inferior patella tendon. It's the lateral collateral ligament. Turn around this way. It's the medial collateral ligament. Let's go inside the knee. It's quite interesting here. This is the ACL. This is the medial meniscus. This is the lateral meniscus. As we turn it around, this is the posterior cruciate ligament right here.
And again, we're going to be talking about arthritis and knee injuries tonight on Sports Doctor. Let's talk about arthritis first. And Dr. Lonner, what causes hip and knee arthritis?
Well, you know, Joe, it's interesting. For many patients, there's really no clear identifiable cause for arthritis. But for other patients, there's a secondary underlying problem that can certainly predispose to arthritis. One common cause in the knee is chronic instability. Patients who long ago lost their anterior cruciate ligament to an injury may have some instability, sometimes very dramatic, sometimes more subtle, and that instability can cause the cartilage to wear down. Another common problem is loss of a meniscus, the shock absorber of the knee. If that's removed, 20 and 30 years later, it's not uncommon for us to see patients come in with arthritis of that compartment of the knee. And there are other causes as well. Obesity is a common cause, some metabolic problems like gout and other things like that.
Now, what would you say would the symptoms be? How can someone tell if they have arthritis?
Well, commonly patients present with a progressive insidious ache in their knee. The joint can become less flexible than it had been in the past. Oftentimes, overactivity can exacerbate the symptoms, and occasionally the pain will diminish with rest.
Is arthritis responsive to the weather? You hear a lot of people saying, like, it's going to rain today. Is that true, or is that like a wives' tale?
Well, I think the best weather reporters are the reporters with arthritis, and it has to do with the weather changes. And as it's about to rain, or if it becomes more humid, the pressure changes do cause patients with arthritis to feel it more in their joints.
And if you do have arthritis, I feel for you this summer, because it's raining constantly. Our toll-free number, if you have questions about arthritis and knee injuries, 1-888-634-7488, locally 856-767-8884. Dave Anselmo, why is evaluation so important?
Well, I think as a physical therapist, evaluations are very important because it allows us to actually get in and see what's going on with the patient. And because a lot of times we get prescriptions from doctors and things change sometimes before the patient comes back to see us. And if we don't really evaluate them thoroughly and see what's going on with the patient, then you really can not be treating the patient for the proper thing. And I think the most important thing to do with evaluation is to actually see what's going on with the patient, what has caused the problem to occur. We could easily, any therapist could treat the symptoms, but we really want to find out during that evaluation what has caused the problem to occur. And it's not until you really find out what it is that caused it and change that, that you're really not going to be effective in your treatment as a physical therapist, because those patients will probably come back to you because you're really not fixing them. You're not really getting them better.
And of course, Kroski's Physical Therapy Sports Medicine Center offering free evaluations for the next 2 weeks. At the end of the program, we'll give you the number to schedule an appointment for that. They're located in Washington Township, Sicklerville, and Woodbury. Right now, though, if you have questions about knee injuries, arthritis, 1-888-634-7488. Dr. Jess Lonner with us from 3B Orthopedics. What are some non-operative treatments available for knee arthritis?
Well, oftentimes we recommend to patients that they enroll in an appropriate physical therapy program to try to strengthen their muscles around the knee, and oftentimes the joint can be unloaded a little bit by performing appropriate exercises. Additionally, most of our patients will be on some kind of medicine, either an anti-inflammatory medication or medicine like Tylenol, which is a pretty good painkiller and has been shown to be effective in the treatment of early arthritis. It's not uncommon for us to inject the knee with corticosteroids or some new injectable materials called hyaluronic acid, which is basically an oily sort of material that can help cushion the knee.
And kind of lubricated?
It's a lubricant. And I'm a big fan of some new nutritional supplements on the market called glucosamine and chondroitin sulfate. And these may help to slow the progression of arthritis. They have a bit of an anti-inflammatory effect, and many of our patients have found relief with these nutritional supplements.
Okay, we're going to move on to the surgical options in just a second. First, though, a caller from Egg Harbor. Don, are you there?
Yes, I am. How you doing?
Thank you for watching. We're talking about knee injuries and arthritis. What can we do for you tonight?
I'm having a hard time here. I had my medial collateral meniscus removed about 15 years ago, and I wanted to know, is there any way you could culture any type of cartilage and inject it back in?
Is that a treatment that's being offered these days?
Well, the treatment for medial meniscus tears, long-term treatment, is presently evolving, and right now there's no injectable material that can be used effectively for patients without a medial meniscus. There are investigations into cartilage transplant technologies, but that's more for a different cartilage problem, one that deals with cartilage defects, potholes within the cartilage, and not defects in the meniscus tissue.
Don, thank you for watching. Thank you for the phone call. What about this glucosamine you mentioned as a, is that be used to grow cartilage?
It doesn't grow cartilage, but it may preserve the cartilage that's there. Different sort of action.
Okay. Again, it's Sports Doctor. We're talking about arthritis and knee injuries. Call us with your questions. 1-888-634-7488. Locally, 856-767-8884. We mentioned some of the non-operative treatments for knee arthritis. Dr. Lonner, what operative treatments are available?
Well, there are several. Patients often come into the office, if they're surgical candidates, they all want the least invasive surgery, so everyone's very high on the possibility of having arthroscopic surgery. But unfortunately, arthroscopic surgery is not the ideal treatment for most patients with arthritis of the knee. It hasn't been as effective as we've always hoped. It's very effective, though, for a patient with arthritis who comes in with a more acute sort of pain, a sharp stabbing pain, pinching pain that may be reflective of a meniscus tear. And in those situations, arthroscopy can be effective for treating the meniscus tear but not the arthritis. Eventually, there are treatments for the arthritis that are very effective, and I'm talking mostly about joint replacement type procedures, either total knee replacement or partial knee replacements.
With the arthroscopic surgery, what is actually done for those individuals?
Well, what we do is we trim out the meniscus if it's torn. Occasionally the cartilage on the arthritic surfaces begin to peel off the bone, much like paint peeling off of the wall. And in those situations, we can actually shave down those loose edges of cartilage.
Okay. Now, we're brought to you, of course, by Cross Keys Physical Therapy, locations in Washington Township, Sicklerville, and Woodbury. The Washington Township and Woodbury locations, I know, feature aquatic therapy. Dave, why do you like that as far as a rehabilitation approach for a patient with arthritis?
Well, what better environment to put someone in with arthritis, which is basically inflammation in a joint, than put them in a warm environment like the water, which is in our aquatic centers is between 90 and 94 degrees. It's going to increase the blood flow, which is going to help to decrease the inflammation, which is actually what's causing the inflammation, the irritation in the joint. We put them in the water, which is buoyancy. We know at waist level we're decreasing the compressive forces on the joints by 50%, and at neck level or shoulder level we're decreasing it by 90%. So therefore we're able to be more aggressive at that point by decompressing the joint, allow us to start doing more stretching and strengthening exercises a lot earlier than we would be able to do on land. So I can't think of a better environment to put someone in that has arthritis.
So it's like a twofold approach.
Exactly.
Okay, back to the phone lines we go. Again, we're toll free. 1-888-634-7488. We lost John from Philadelphia, but we'll come back to him in just a second. Dr. Lonner, what type of treatment options do you recommend with individuals who are athletes that may have arthritis?
Well, first thing you need to counsel them in is that they need to modify the way they perform their athletic activities. Patients who have arthritis who enjoy running may need to be counseled to avoid that sort of impact activity, and they may be better suited to riding a bicycle, swimming for exercise, and I think you need to try to transition them to a different sort of athletic activity. If eventually they require surgery, then oftentimes they'll need to modify their athletic involvement.
Dave, as a physical therapist, do you see athletes with arthritis, and if so, what are your goals as a therapist?
Yes, we do. Well, sporting events are very physical, and some of the things they do are very repetitive. And we know that repetitive activities leads to a lot of inflammation, which can get into the joints, which you see quite often. So athletes are not subjective not to be able to get arthritis. They get arthritis just as well. My goals are basically the same as they would be as someone that's a non-athlete, and that would basically be to decrease their inflammation, increase the range of motion to as normal as they possibly can, and increase their strength and get them back to the functional, whether it be ADLs or returning back to the sport. That's basically would be our goals.
Okay, Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're talking arthritis and knee injuries. Toll free, 1-888-634-7488. Let's go to the phone lines and talk to Albert from Philadelphia. Albert, are you there?
Yes, I am.
Hi, what can we do for you tonight?
Yes, yes.
Go right ahead, we can hear you.
Yes, in 1992, April 1992, I was riding a bicycle and I fell and I broke my leg at the tibia plateau.
Mm-hmm.
And they installed 6 pins in a plate.
Okay.
The doctors at the VA hospital installed 6 pins in a plate, and I've gained. I used to exercise a lot, but now I don't exercise as much, and I've gained a whole lot of weight.
Albert, what specifically is your question?
My question is, if I got those pins and plates removed, would it make me? Would it help me to become more active?
Is it possible that do the knees and plates, are they ever removed in that type of a?
Occasionally we do remove the hardware that's present. My sense, though, is that Albert's discomfort is probably coming from arthritis of the knee that's set in as a result of the injury. Occasionally, though, the plates can be the source of some discomfort, and by removing those, you may feel more comfortable. But there's probably more of an underlying problem within the joint from arthritis that's creating a lot of your discomfort.
Sounds like someone who could take advantage of the free knee evaluation offer, which Cross Keys is offering. We'll give you the number at the end of the program. Right now, toll free, 1-888-634-7488 with your question. Back to Philadelphia. John, welcome to Sports Doctor.
Yes, good evening, gentlemen. How are you doing?
Good, how are you?
Very good. I have a question. I don't have a knee injury that I know of, but something's been bothering me for a few years. I'm just over 40 and play some sports, bike ride, tennis. But I've noticed over the years that my knee, when I bend down to do any kind of squatting or walking up steps, I'm getting more of a popping sound or like a grinding sound in that knee, and I wonder if there's anything going on.
Popping sound or grinding, is that indicative of anything, or is that just a normal part of aging?
Oh, there could be a couple of things that be going on, but if you're getting the popping and grinding and you're not having any pain, it's not. Sometimes it's very common, but usually in a situation like that where you're getting popping and grinding, it's because you have a muscle imbalance in your knee. Usually the muscles on the outside of your knee are going to be stronger than the muscles on the inside of your knee that are probably causing your patella to pull laterally. As you look at this femur here, you can see that if you look on the side, you can see how this notch here is higher than the medial side, and it has a tendency to come up. If it pulls lateral, this patella is going to hit on this condyle here and cause a popping, and sometimes they call it grinding. And you got to be careful with that because it can cause some cartilage damage, and you'll start getting pain if that repetitively comes on. But if you're not feeling pain, I'm not really sure that's happening. So you might be one that will take advantage of that free knee evaluation. So schedule up at one of the offices.
Okay, John, and we will give you that number at the end of the program to take advantage of that offer. Again, we're brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. Dave Anselmo with us. He's a physical therapist there. And also Dr. Jess Lonner, who is an orthopedic surgeon with 3B Orthopedics in New Jersey and Pennsylvania. Our next caller at 1-888-634-7488 from Atlantic City. The caller's name is Eric. Eric, welcome to Sports Doctor. Are you there? Hello, Eric?
Yeah.
Hi, how are you doing tonight?
Yeah, how you doing?
Good. What can we do for you tonight?
Well, I have a question.
Mm-hmm. I think, did we lose Eric? I think we lost Eric. Okay, again, the number 1-888-634-7488. We're going to take a short break. We want to talk about the hip as well, too. We've been talking about knee problems. We want to move on to the hip, and we also want to take more of your questions. Toll free, 1-888-634-7488, or email us, WPSJTV@AOL.com. More of Sports Doctor right after this.
Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Oh, you're lucky, young fella. Mm-hmm. You know, hospitals didn't even use ether for your procedure until about 1846. Yeah, slap on a few live leeches, grab a hacksaw, get to work. Of course, we don't use leeches anymore.
It's fun to know history. Find curious facts from America's past at loc.gov, the Library of Congress website.
Thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy with locations in Washington Township, Sicklerville, and Woodbury. They are offering free knee and hip evaluations for the next 2 weeks. We'll give you numbers to schedule an appointment at the end of the program. Right now, you can call us with a question about knee or hip problems at 1-888-634-7488. We have Dr. Jess Lonner with us, an orthopedic surgeon with 3B Orthopedics, and also Dave Anselmo, a physical therapist with Cross Keys Physical Therapy. On the line with us right now is Harry. Harry is from Edgewater Park. Harry, what can we do for you tonight?
Yeah, how you doing?
Good. How are you?
Not bad. I just like maybe the doctor's opinion on my right knee. As I was getting out of a small car, I was delivering prescriptions. I feel as though I may have twisted that right knee, like pushing out and off of the seat. It bothers me pretty good bit, some days more than others. What do you think maybe could I have done? I'm almost sure that's how I did do it.
Okay, I guess that could be a number of things.
It could be a whole bunch of things. It's actually a very common scenario in patients who are getting out of a low car or squatting down to pick something off the floor when suddenly they feel a sharp pain in the knee. And oftentimes patients like you, Harry, may have torn the cartilage in their knee joint, the meniscus cartilage. But it could be a variety of things. It's really hard to say with any sense of definity.
Harry, it sounds like someone that also can take advantage of the free evaluation being offered by Cross Keys Physical Therapy. We'll give you numbers for that at the end of the program. Right now, let's move on and talk to Steve from Sicklerville. Steve, welcome to Sports Doctor. Steve, are you there?
Yes.
Hi, go right ahead with your question.
Yes. I have 80% of the medial and lateral meniscus removed out of my knee. And I was wondering, would I need a knee replacement eventually?
Is he a candidate for knee replacement?
Well, I tell you, Steve, it's hard to know. Many patients who've had the majority of their meniscus tissue taken out do develop progressive arthritis over the years, but oftentimes it might take several decades, and most patients with arthritis don't need knee replacement.
Thank you for the call. 1-888-634-7488. Sports Doctor, talking about arthritis and knee injuries and also the hip. And Dr. Lonner, when do you know? Well, before I ask this question, let's go back to the phone lines. Marty and Absecon, are you there?
Yes, how are you?
Good, how are you?
I'm in pain.
Uh-oh.
I've got an ankle that just in the middle of the night swelled up. I mean, I don't know what caused it. I really didn't do anything to make it, feel any pain or anything. Just that one morning I got up and I couldn't put any weight on it. The day after, I've been putting ice on it. The day after, now I can walk on it a little bit, but it's very sore and it's still swollen. Any ideas?
A swollen ankle.
Well, also it's a tough question to answer, but could be reflective of several things. If you had a particularly active day the day before, you may just have some nonspecific inflammation in the ankle joint. Occasionally that's a manifestation of gout or some other systemic problem. Could be arthritis. Could be several things.
Sounds like someone else who could take advantage of the free evaluation being offered from Cross Keys Physical Therapy Sports Medicine Center. And we'll give you numbers for that at the end of the program. Let's talk about hip arthritis, Dr. Lonner. When do we know we have hip arthritis?
Well, patients who have hip arthritis come in complaining of groin pain.
Groin pain?
Groin pain. The hip joint is actually in the region of the groin. Often when patients come into the office complaining of buttock pain or thigh pain, it's related to a problem in the lower back or the bursa of the hip, which is not a reflection of hip arthritis. So hip arthritis actually causes pain in the groin.
And when do we know if we're going to need a hip replacement or not?
Well, if the hip arthritis is debilitating enough and it's restricting your activities, if x-rays show severe arthritis and non-surgical interventions have failed to relieve the pain, then perhaps at that point a hip replacement would be appropriate.
Okay, back to the phone lines. Toll free, 1-888-634-7488. And don't forget, you can email your question too. We'll check them in just a bit. It is the email address that you want to email us to is wpsjtv@aol.com. Florence from Philadelphia is on the line right now. Welcome to Sports Doctor, Florence.
Hello.
Hi, how are you?
Hi. Yes, I'm calling in reference to, I have my sciatic nerve, the nerve in my left leg goes down from my thigh to my leg. And I have been in a lot of pain for it, but I went to therapy and I still have it. So I was wondering if there's any cure for it, anything I could take?
The sciatic nerve.
What were they doing for you in therapy?
Hello? Florence, are you there?
Florence, what kind of treatment were you getting in therapy for your sciatic nerve?
I couldn't hear you. What did you say?
So what kind of treatment were you receiving in therapy for your sciatic nerve?
Oh, just exercise.
What kind of exercises were you doing?
Standing against the wall, just, squatting down, back and forth, and just squatting.
Okay.
Like, more or less.
Well, that could be the first thing that could be the problem. If you have a little irritation in there, that might be part of the thing right there. They're not doing anything really to decrease that inflammation. So you might want to get reevaluated from your physician or someone else to see what's going on with that sciatic nerve. You could be impinged from your back that can cause it down to things. It could be multiple things, but to answer exactly what's going on. But I can tell you that just doing squatting is not necessarily going to help that problem.
Florence, thank you for watching. Thank you for the phone call. We're just mentioning about hip replacement, Dr. Lonner. How long does a hip replacement last?
Well, the results of hip replacement today are really quite remarkable, and in general we expect that the hip replacements that we're performing now should last 15 to 20 years in over 90% of patients.
That's pretty good. We got time, I think, for one more phone call. Tom in Glassboro, welcome to Sports Doctor.
Hi, guys.
Hi, how are you?
All right. I had a ACL surgery probably about 2 years ago. I had a replacement from a cadaver, and I had gone to physical therapy at one place, and then I went to Cross Keys Physical Therapy, and over in Woodbury, and I think it was a Cassie or a Karen. She did a great job on my knee because I still had pain before, and she did a great job and get me back to playing sports. My question was, I don't know if it's just in my head or what, but I'm real concerned about the ACL. Like, I'll play street hockey, roller hockey, softball, but sometimes after the next day or shortly after, I'll have a little bit of pain. Now, is this something I should be concerned of if I don't get any swelling?
Okay, about 20 seconds for this.
No, I don't think if you're having some pain, it might be just a matter of you're having some inflammation. Let's do this group here. It might be just a matter of you're having some inflammation. We know from side-to-side activities when you're doing that type of sport, it puts a lot of stress on the ACL. But if you're having some discomfort of any kind, it could be just inflammation. So make sure you ice the knee down after doing that activity.
Okay.
That's the best advice I can give you at this point.
We're going to have to stop here and put the numbers up on the screen for Cross Keys Physical Therapy. Again, if you'd like to take advantage of their free knee and hip evaluation offer, you just need to schedule an appointment. To do so in Sicklerville, the number is 856-728-1900. In Woodbury, it is 856-853-0988. And in Washington Township, it is 856-374-3707. Also, you can check their website at www.physicaltherapysite.com. I want to thank Dr. Jess Lonner for joining us tonight, an orthopedic surgeon. He's with 3B Orthopedics in New Jersey and Pennsylvania, and also Dave Anselmo, a physical therapist with Cross Keys Physical Therapy. We're taking the month of July off. Our next show will be August 14th. We'll be with Dr. John Salvo with Cooper Orthopedics. Please join us then. Until then, for Cross Keys Physical Therapy, I'm Joe Trapana. Stay well.